Okay, so we previously met you and talked to you previously about prioritizing your dental health and how important it is to the rest of your body. And lots of patients just think, oh, dentistry is all about cosmetics. They turn on the television, it's about whitening your teeth, and that's all the toothpaste companies are selling, or whiter, brighter teeth. They don't really sell health. But cosmetics isn't a bad word. We're a cosmetic dental practice. We put a lot of focus on cosmetics here. So what's the importance of cosmetic dentistry? Why should you prioritize that? What are those things besides just looking good? What does that play out to in the real world? So I'm here with Dr. Perez and Dr. Zinn of the Dental Care Group today, and we're going to talk about prioritizing cosmetic dentistry, what it means to you. So Dr. Perez, you are very, very conscious when it comes to cosmetics. What are you seeing with your patients? Specifically, you do Invisalign like I do, aligning teeth. What's the importance with that? What does that do for the overall health?
So, overall, alignment of the teeth really does affect just the way the patients are able to clean their teeth. When their teeth are crowded, food and bacteria get impacted. Everything gets in there, and it's hard, really, really hard to clean.
By the way, what are food and bacteria? What's that cause?
Bad breath.
Bad breath.
Bad
Okay.
breath.
Any of you out there want bad breath? I don't
Oh,
think
it
so.
does.
Okay.
Definitely.
So we want to keep those numbers low. Okay. So aligning your teeth keeps the bacteria levels down because
Mhm.
less plaque buildup, less food buildup.
Yes, exactly.
Keep going.
Yes. Another thing is aligning the teeth can put the teeth in a better position so they don't wear because teeth don't age, they wear. So when the teeth are not in alignment, they crack. They're constantly cracking, teeth break. So overall, they you tend to see a lot more wear than if the teeth were aligned.
Are you ever amazed that when we're talking, patients sometimes come from other offices, they've never heard about aligning their teeth before. They just don't get it. And we try to put it in terms of things that people understand. Like we've talked before about, if you went to the tire store, even if you
Mm-hmm.
bought new tires or if you had old tires that were
Yeah.
out of alignment, if the mechanic is telling you to align your teeth,
Yeah.
what are you doing?
You need to align your tires. You
Immediately,
need to
right?
align
You
your
don't even
tires.
hesitate. So we're talking to people about aligning their teeth
Mm-hmm.
and they don't get it lots of times.
Mm-hmm.
And that's one of the things we're trying to stress to you is that you have to prioritize these things because it's going to have some long-term effects down the road. Your teeth will not last you a lifetime if they're out of alignment.
Mm-hmm.
So, Dr. Zinn, let's talk about cosmetic dentistry and the different effects it has besides tooth alignment, some of the things that we do in the office and the effects it has on patients.
Well, what cosmetic dentistry does is it gives us our swagger back. It gives us our confidence. It gives us our smile back. And when teeth are in the best position possible, looking the best, they're also the healthiest. So, overall health, feeling good about yourself, walking around knowing that you have a clean mouth, knowing that things are working the way that they're supposed to, in the right alignment, not going to wear themselves out, makes you feel good about yourself. Makes you feel good about yourself, not in dentistry, because we don't always think about our teeth, but you feel good about yourself knowing that you're healthy, going about your day, knowing things aren't going to break down on you, and that everything is going to be successful.
Have you ever noticed a difference when you take those start and finish photos on patients? Have you ever had a patient actually look at you? I've had this happen a number of times, and you ask them to smile for those photos, and it's sad, but they'll say to you, I don't even remember how to smile.
I have a patient right now that we're working on all of his teeth, and all of these teeth have been a problem for this patient for a long time. His self confidence is non existent, and truthfully, he doesn't know how to smile. I asked him the other day as we got further along this process to smile. I wanted to see the work that we've done. He didn't even know how to move his upper lip. He kind of just played with it and showed me. But he's almost there. We've almost got him completely where we want him to be, where he wants to be, knowing that he's able to smile beautifully, confidently, show the world how good his teeth look and how healthy he is.
Okay, so one more for either of you. You can jump in this as you want. Do you ever notice, here we are in South Florida, one of the capitals of plastic surgery, let's face it, from head to toe, the priority that people place on that, and they don't get how important the smile is because they can look in the mirror, but they're not smiling when they look in the mirror, and that's one of the things they're overlooking. They're looking at their hair, they're looking at if they have any wrinkles, the rest of their body. How important is that smile when it comes to cosmetics, finishing it?
Well, I think a big thing too is a lot of patients end up also wanting veneers. So veneers does improve the smile. So aligning the teeth in order to get to the point where we can do veneers that will be successful for the rest of your life in a way. So that way they don't crack, so you're happy, so you can confidently smile. It's a big deal.
Okay, well, you just touched another subject. So let's just go another minute or two on this veneer subject because thank you, Instagram, when it
Yeah.
comes to veneers, but poo-poo Instagram when it comes to veneers because we see a lot of patients going out of the country, and the only reason they're going out of the country is to save a buck.
Mm-hmm.
And that Colombia is like become one of the capitals.
Yes.
Tell, our audience, what are you seeing from these patients that go to Colombia with the results that they don't know that we know because we're professionals? What do you see?
I see a lot of gum inflammation. A lot of these veneers are being made just to fit over the teeth. They look very opaque. They're not very lifelike. So they're just kind of put on the teeth, and that causes a lot of plaque buildup, a lot of bacteria buildup, and then that goes back to your overall health. So, when things are not done correctly, then that also affects your overall health.
A lot of the times when we see these veneer patients, they're coming to us because something happened. The veneer didn't stay on.
Mm-hmm.
So it's not about just putting veneers on these teeth and making them look spectacular. It's a full process. If your teeth are not in the best position possible, imagine biting one day and that veneer popping right off. We see it all the time. So make sure that you're doing things the right way. Make sure that you do it the right way the first time. And moving forward, you maintain that by coming in, working with your dentist, making sure that everything is looking healthy. And that's only going to make these restorations last that much longer.
Look, one of my mantras is when it comes to medical decisions, if you base medical decisions and let money dictate that as your first thing, you're going to make a bad decision. And going to Colombia or any place where you're going to get cheaper veneers, we see people pay the price. They come back here and they have to redo the work, and oftentimes they need gum work on top of that. They need root canals. They need things done. So when it comes to healthcare, anything, don't cut yourself short. Don't make it based on money alone, or you're going to be in big trouble.
Yep.
Okay.
Very true.
So a lot of advice for you today from the panel. And so bottom line is keep prioritizing your dental care, your oral health. It's super important. You will pay the price down the road. That old Fram oil filter commercial, if you remember. You can pay me now or pay me later. When you end up paying the dentist later, it's a lot more. It's a lot more work. It's a lot more money. So do it right the first time. And I think you'll be really happy. And you got great professionals here that can make it happen. So have a great day. Keep smiling.
Keep smiling.